Let's see, wait. You're on.
My name is Sharon McCarthy. Good afternoon, everyone. I'm a member of the TLC team, and I also have a background in counseling. I was an addiction counselor for many years at the Salvation Army. Today we are talking about dysfunction. Today's discussion is on identifying and correcting dysfunction. The dictionary describes dysfunction as any behavior that is not normal or functioning normal. More importantly, what is this behavior that disrupts the normal flow of interaction with ourselves and others? You can read along with me if you like. We can address it first by talking about dysfunction in families and how we can identify those behaviors and correct them. Personally, I believe it is a lot easier to identify than correct because of the denial involved in recognizing and accepting the error of these behaviors. And I believe that has a lot to do with background, history, and perception. Perception is key. Changing our thinking then changes our perception. Changing our thinking about ourselves, our others, life in general, what we perceive as God or our higher power, and expanding our understanding of others, and our place in this world and the universe. Life is a journey of learning, growing, changing, forgiving, loving, and becoming the best that we can be, through our adversities and our triumphs, and getting connected on a spiritual level with an open heart. Dysfunction is often masked in judgmental behaviors that are counterproductive to well-being. What are these behaviors? Prejudice, rudeness, insensitivity, unkindness, lack of perception, inconsistency, lack of compassion, competitiveness, jealousy, insincerity, dishonesty, misrepresentation, misinterpretation, judgment, impatience, verbal abuse, emotional abuse, lack of acceptance, taunting, superior attitude, perfection, criticism, prideful, lack of forgiveness, self-righteousness, and sarcasm. This is also predominant in bullying in schools. Even as adults, how can we expect our children to learn healthy ways of interacting if we keep repeating our own dysfunctions and prejudices in the workplace or elsewhere as adults? We see it all around us. We see others struggling with this in every field. Behavior that is not centered in an open, honest, and sincere heart is what creates and contributes to all of our social and emotional problems. It is all at the core of dysfunction and failures. So now we can talk about dysfunctional families. A dysfunctional family is a family in which conflict, misbehavior, and often abuse on the part of individual members occur continually and regularly, leading other members to accommodate such actions. Children sometimes grow up in such families with the understanding that such an arrangement is normal. Dysfunctional families are primarily a result of codependent adults and may also be affected by addictions, such as substance abuse, alcohol or drugs, even pharmaceuticals. Other origins include untreated mental illness and parents emulating or overcorrecting their own dysfunctional parents. In some cases, a childlike parent will allow the dominant parent to abuse their children. Perceptions. There is an example here, but we can talk about that after as far as the contents of specific examples. Excuse me. Perceptions. A common misperception of dysfunctional families is the mistaken belief that the parents are on the verge of separation and divorce. While this is true in a few cases, often the marriage bond is very strong as the parents' faults actually complement each other. In short, they have nowhere else to go. Excuse me. However, this does not necessarily mean the family's situation is stable. Any major stressor, such as relocation, unemployment, underemployment, illness, natural disaster, etc., can cause existing conflicts affecting the children to become much worse. Dysfunctional families have no social, financial, or intellectual bounds. Nevertheless, Until recent decades, the concept of a dysfunctional family was not taken seriously by professionals. Therapists, social workers, teachers, counselors, clergy, and the like, especially among the middle and upper classes. Any intervention would have been seen as violating the sanctity of marriage and increasing the probability of divorce, which was socially unacceptable at the time. Children were expected to obey their parents, ultimately the father, and cope with the situation alone. Examples: dysfunctional family members have common features and behaviors, patterns as a result of their experiences within the family structure. This tends to reinforce the dysfunctional behavior, either through enabling or perpetuation. The family unit can be affected by a variety of factors. Common features. These features occur in most dysfunctional families: lack of empathy, understanding, and sensitivity towards certain family members, while expressing extreme empathy towards one or more members, or even pets, who have real or perceived special needs. In other words, one family member continuously receives far more than he or she deserves, while another is marginalized. Denial, a refusal to acknowledge abusive behavior, also known as the elephant in the room. You hear that a lot. Inadequate or missing boundaries for self. Examples: tolerating inappropriate treatment from others, failing to express what is acceptable and unacceptable treatment, tolerance of physical, emotional, or sexual abuse, disrespect of others' boundaries, physical contact that other person dislikes, breaking important promises without just cause, purposefully violating a boundary another person has expressed. Extremes in conflict, either too much fighting or insufficient fighting, arguing between the family members. Unequal or unfair treatment of one or more family members due to their gender, age, birth order, family role, the mother or the father, abilities, race, caste, etc. May include frequent appeasement of one member at the expense of others, or an uneven enforcement of rules. Though not universal among dysfunctional families, and by no means exclusive to them, the following features are typical of dysfunctional families: abnormally high levels of jealousy or other controlling behaviors, conflict influenced by marital status, between divorced or separated parents usually related to or arising from their breakup, conflict between parents who remain married, often for the perceived sake of the children, but whose separation or divorce would in fact remove a detrimental influence on those children, and that is often the case. Must be evaluated on a case-by-case basis, as breakup often harms children. Parents who wish to divorce but cannot due to financial, societal, including religious, or legal reasons. Children afraid to talk within or outside the family about what is happening at home, or are otherwise fearful of their parents. Abnormal sexual behavior such as adultery, promiscuity, incest, or conversely, asexuality. Lack of time spent together, especially in recreational activities and social events, meaning they never do anything as a family. So that's kind of breaks down what happens within a dysfunctional family. On the last page here, we have some references that might be, you can go through in your own time. A lot of references. John Bradshaw was a very good speaker and writer, and he spoke often on dysfunctional families. And he wrote several books. One is Healing the Shame That Binds You, which is an excellent book to help in the healing. Homecoming, which is reclaiming and healing your inner child. A lot of us grew up in alcoholic homes, and so there was a lot of history that we needed to overcome and face and get out of denial about. So he addresses that in Reclaiming Your Inner Child. He also wrote On the Family. And Charles Whitefield, Healing the Child Within, Discovery and Recovery for Adult Children of Dysfunctional Families. And there are other links and there's a lot of very good reading material out there. There's also a lot of biographies and autobiographies on recovery that a lot of people have written on their own personal struggles and triumphs, and I found them very helpful myself, and a lot of people do, and they can be very, very insightful. So, we can open the floor to discussion if you would like. Does anyone have anything that they'd like to offer on what we've just discussed?
It was funny when I first started reading this and I felt the bullying in schools and even adults and stuff. And had that conversation with people the other day.
Yeah. It's very prevalent, and it really is a problem out there. I mean, as adults, we are teaching our children to be bullies because we're still bullies as adults sometimes. And that's why I was discussing that and saying that often in the workplace that happens. You see that over and over. So we need
actually, harassment, social harassment has become the softened label for actual bullying.
Okay.
And that's how I see it. I don't see really any difference between the two ideas.
No, I don't
And today we call it harassment, but it's really the same thing as bullying.
It is.
You know,
And it also, it has to do with all of these behaviors that are on the first page here, which, as I was saying, I think personally it's a spiritual disconnect. It's like, I think once we get to a place in our own life, whatever that may be, if we have a spiritual connection, I think we start to try to be the best that we can be. And I think that a lot of these behaviors are learned growing up in dysfunctional families, and we have to address it because all of these things happen on a daily basis, and it makes a difference in the way one feels. Whether you're walking down the street or shopping in a shopping center or in the workplace or with friends or family or whatever, all of these behaviors are things that impact us, how we feel about ourselves. And it's not being true to ourselves, and we're not being real. All these things, you know, that when we behave in that way, we're not really being real. Because I believe most people have a good heart and mean well. They're disconnected, they've gotten lost. So, and that causes a lot of harm and a lot of hurt, not only to ourselves, but others. So.
I was kind of struck by the word judgment on the list
Okay.
in this way. You can pass judgment on a situation or a person's actions, but that's not exactly the same as being judgmental.
Exactly.
And
That's true.
it's interesting, the English language allows us to use this word in two very distinct ways and not have the same meaning, even though it's the same word. Because when I'm judgmental towards someone, that is negative. Because it implies that I'm putting myself above them, or I'm being self-righteous, which is another title or behavior on the list. But when someone passes judgment on behavior, it doesn't always mean that it's negative, that judgment is done in a negative way. So that's the point I'm trying to make here.
I agree, because I think sometimes we need constructive criticism.
Right, and we need another person to say, you're doing something that is out of the realm of ethical responsibility, or it's not moral what you're doing.
Exactly.
And how we say it is really, I think, the matter here, right?
I agree, and I think we do have to be called on behaviors like that need correcting, but that isn't malicious.
No, it's not, that's right.
There's like, if we're judging someone in a malicious way, and we're just, whether it's about their race or their income status or what they're wearing or how thin or how heavy, or that's all malicious kind of judging. And it's like none of us know another person's history or background or what they're dealing with internally, correct?
Exactly.
So yes, I agree with you
Good.
on the
Good.
judgment.
Yeah, I figured you might, but it was the one word that jumped out at me on the list that it's just interesting how it doesn't take much to flip it from being positive to being negative.
And doesn't that have a lot to do with perception?
It does,
See?
absolutely.
So that depends on what how we perceive things
Mm-hmm.
and in what context we take things.
Mhm.
Exactly. I agree.
I like what it says too about behavior is not centered in an open, honest, and sincere heart in what creates and contributes to all of our social emotional problems. If you do really have an openness about yourself and you genuinely care about other people, more than likely you're not ever going to be, well, you're going to have less opportunity to be dysfunctional in your relationships.
Exactly.
Yeah.
Which is what I'm talking about when we talk about being true to ourselves and being honest with ourselves. If we are truthful and we're honest, those things come up less and less.
Very true.
Not being fake. Not
You're
being
saying if we're
phony.
true to ourselves.
True to ourselves, not and other people.
Yeah.
Not being fake and phony.
Mhm.
You know, if
Yeah.
we're just real, accept who we are,
Mhm.
and accept others as they are for who they are, right?
Mhm.
Without all these dysfunctional
Mhm.
behaviors that we bring into
Mhm.
relationships. And that's not an easy thing to do. We're all products of. That's why life is a journey. And it is a journey of learning and growing and forgiving and changing and, you know, embracing all of our adversity and our triumphs. And that's a lifelong process, I think.
She didn't say battle, she said process.
No, yeah. And I think, again, that's perception. If
Yeah.
we start to see things as a process instead of a battle,
Right.
that helps us in our recovery. That helps us in our moving forward because we don't see ourselves as a victim.
Right. And you're not stuck in one place. You're moving.
Exactly.
You're moving.
Yeah, it's not about being a victim. It's
Mhm.
about and that's the other thing too. I think when people talk about a lot of this stuff, if it's addressed, and I've said this before because this is where my counseling background came in, okay? So it's like, or my own experience too in the past. If we talk about things and we talk about them to kind of address them and bring them to the surface to say, okay, this is what happened and how do I change this? How can I see this differently so I can move forward? How can I forgive this? What can I do about this to change? You know what I mean? What's going on in my life? Instead of seeing as what's happened as a victim, you're moving on. But I know people who had, like you were saying, stay stuck and for years go over and over and over, woe is me, poor me. I think it's very important. I think it's absolutely crucial and essential to not see it as victimhood
Mm-hmm.
and to see it as a process. Exactly. And not a battle, you know. It wasn't easy all the time when you're being truthful about it, but, you know, you gotta say, okay, so I'm grateful for that because this is what I've learned. And I'm who I am today because of, I mean, any of us can look back and say, okay, I'm grateful, really. And people can look at you with four eyes and think you're crazy. How can you be grateful for that experience or whatever? Well, because it makes a difference in how you grow. Truly it does. I don't think any of us get out of life unscathed.
You know, throughout everything that you offered us today, there hasn't been any mention about fear. What are your thoughts about that in relation to dysfunction?
I think fear is a big part of dysfunction. Yeah, I think all of these things create fear. So that's a good point. And actually that fear was something that I dealt with way back and I had to overcome because I didn't even leave my home.
You didn't leave your home?
I didn't leave my home. There was so much fear and so much anxiety that I became agoraphobic and I didn't leave my home for several years actually. And I mean I did periodically, but I was struggling with overcoming and recovery and learning and reading during that time. And fear was a very big part of that. So it's interesting that you say that.
I think there's a lot of overcompensation when people are fearful too. I know in my life that when I've been afraid, I've either exaggerated my pretense that I was okay in the face of fear.
That was your denial.
That was my denial. Or I exaggerated my response to the fear by running as far away as I could, as fast as I could, or getting so angry to stand and fight that I became sometimes hostile towards other people or towards my friends, either verbally or even sometimes physically. You know, those extremes, I think, come about when you don't know how to handle your fear.
Yes.
You know, you act like an animal again. You know, and that's what it comes down to, all the basic instincts of fight or flight. And I think that's why there's so much disruption, I think, in dysfunctional families, is when you've got 3 or 4 people in the same household and they're all living in fear and they all handle the fear in a different way, and then they start throwing things at each other or calling each other names, or they, you know, whatever it is, it just keeps mushrooming like this big, you know, cloud of Hiroshima. It's
Right.
amazing the way it evolves. It takes a life of its own.
It does take a life
Yeah.
of its own, and that is exactly what anger is usually. It's fear.
It's true.
And
it's
I
true.
guess if we could step back in the moment, which isn't always easy when it's happening, if we could step back and say, okay, this person's really hurting, and that's why they're lashing out at me like this. And I guess that's what I'm thinking, which is so important about being real. See, because we aren't real. We lash out, we say things, you know, that are just over the top and we don't mean, and has nothing to do really with the situation, or, you know, we attack the other person, and, you know, verbally or emotionally, and sometimes in dysfunctional families it is the physical abuse as well. And that's because we're not in the moment. We're not in the moment of now, and we're not experiencing being true to ourselves, being real. And that's hard. That's really hard when you're in dysfunctional dynamics. You do get angry. It's really hard to be kind and step back and be considerate and soft-hearted and all of those things. It's not human. It's not humanly possible. That's part of our
It
journey.
is. It's not humanly possible. That's very true.
Yeah.
Mom says to me once in a while, remember, when words come out of your mouth, you can't take them back.
So true.
And remember, even if you could take them back, you still leave the pain behind of what you said. If you said something that you shouldn't have said.
Yeah.
I
We
mean,
damage people.
That wisdom she has been espousing to me since I was a little child. And at first, you know, when she'd say it and repeat it, we'd kind of laugh and, oh, there goes Mom again, you know, giving us her words of wisdom. But as
She was
I've grown
very
up and
wise.
become an adult and realized how true those words are from my personal relationships, where I have said things to other people that really hurt them.
Yeah.
And even when you go and apologize, although that's the expected and the right thing to do, that person
The
may
damage.
say, well, I'll forgive you, but they still have the pain of it.
The damage is done.
The damage is done. You can't fix it. They might be able to cope with it, but you can't remove it. You can't, once it's done, you can't do anything about it.
I know, we're all a bunch of wounded soldiers.
Yeah.
If you think about it,
It's true.
from words.
Yeah, it's true.
Cutting words throughout
Yeah.
our whole lifetime from one another.
Yeah.
It's like if we picture the whole universe, everybody, the way they have hurt one another. It's really kind of
Yeah.
very tragic. But
Yeah.
there's a lot of good too. But we also do that to ourselves with our self-talk.
Yes,
You know.
internally.
Yeah, until we get balanced.
Run
and
those
centered.
bad tapes over
Yeah.
and over. And like you were saying, when you victimize yourself repeatedly, you begin to act, think, and perform like a, act and think like a victim,
Right,
instead of a person who's in the process of getting better.
exactly. Yeah.
Well, yeah, true.
So, life is very interesting. It's quite a journey, isn't it? So,
Why do you think it is that professionals were hesitant to consider dysfunction in families as important?
I think it was, again, upbringing.
Was it cultural?
perception,
Yeah,
Cultural.
it was cultural for them as much
Yeah.
as anybody else, I guess.
I think
And
so.
even with their education, they just didn't see the depth of it, probably.
I think as a society, we just weren't aware of that. We are becoming more aware of it.
Yeah.
But
Yeah, that I guess that whole self-knowledge movement started in the 60s and 70s, or maybe in the 50s, where people were actually writing books about how to make yourself better, and I mean, I remember on the shelves being full of those kinds of self-help books. You know, I forget some of the names of them, but you know, I'm okay, you're okay was one of them, and all these different, you know, different authors trying to convey what they came to understand as,
Oh, there are tons.
yeah, how dysfunction is out there. And we all are okay.
We are okay.
We're made okay in the first place.
And I think it is being centered and spiritually connected. I think that solves a lot once we get to that place in our own life, after we come to terms with a lot of the things that we've experienced, and we let it go and we forgive it and move forward. I think that's very important in keeping ourselves centered.
I'd be interested to hear from the other folks in the room what your experiences have been professionally when you're engaged with your clients. I mean, you obviously occasionally run into some dysfunctional clients or some dysfunctional families. I mean, how could you not? So, I mean, just without sharing a name, maybe you could speak a little bit about something you've encountered and what it was like for you and how you dealt with it. If one of you would be willing to share that.
Clients look at you and go, God, you're so fat. How can you do that? You know, I'd like you to do this, but I don't think you can. Type of stuff, and it's like,
That's hurtful.
yeah, think.
That
Sure
is
you can
very
do that? Yeah,
Yeah.
yeah.
How do you respond?
They just say, I don't know if you can do this. And it's like, oh, give me a shot. You know, you just let it go.
Have you experienced any real intense dysfunctional behavior in caring for someone?
I did. I
Where
had
it
a
was very
client
difficult for you to be
that
there?
he did not like fat people. And it was, I think it was at the Arbors. I played a game with him for a few minutes, and then he, just heck with it, and he went into his bedroom, and I called the agency and said, you know, this is what Sam did, and I'm not going into his bedroom. It was, like I say, at the Arbors, and he just went in the room and shut the door, and they said, okay, I guess you can go home. But he had no problem with anybody else that went in that was smaller. It's like,
Yeah, that's interesting. So again, that's history and perception, and who knows what his background was and what he's been dealing with, and you know, that's unfortunate when that happens. What about verbal abuse or someone who has been?
I worked in a nursing home and an Alzheimer's unit, so
oh, yeah.
And how do you handle that?
just take it in stride.
Because you know they're not in the right.
Does that mean you don't take it personally?
Right.
Okay, I think that's the right way to approach it.
Most of the time you can not take it personally, but if you're having a bad day, yes, sometimes you do end up taking it personally.
There's still some pain involved there, isn't
Right.
there? Yeah. Professional detachment is a skill. It's not or maybe even consider it a gift. Because many people who are professionals don't know how to detach themselves in a positive professional way. They detach, but it isn't necessarily in a positive professional way.
Okay, but I think that also is included in life in general. Once we get to a place where we where we understand all of this, we are able to go through our daily life. It's the same thing, and detach.
Very true.
Because there are a lot of dysfunctional people around us.
Yeah.
With all of these behaviors that we were talking about. And if we can see it that way and understand, well, you know, this is not about me. This is about them and where they're at and how they're perceiving life.
True.
So I don't need to take this on and take this personally. So if we can use that detachment in our daily interactions, it's much healthier. Because then we understand that this is part of the human condition. And everybody's learning and growing. And what they say and do, just because one says it does not make it so, does not mean it's true. So just because someone says something hurtful to you does not mean it's true. Do you know what I'm saying? It's not, so we have to, it's where they're coming from. So we need to do exactly what you were just saying. not just in the workplace. We have to do it in our life in general, everywhere, in our family and in life in general, with our friends, with our daily interactions. And then we're able to kind of be removed from that hurtfulness and that damage because we know it's not about me, it's about them, where they're coming from, right? It's not about you, it's about where they're coming from. So if we can be cognitive of that and stay in that place in our head, then the darts don't kind of damage so much, right?
I had another hurtful thing. A mom, she's in her 90s, 3 adult children, one's a nurse and 2 brothers are professional, and one's a school teacher and one is he writes up jobs at a local car dealership. And I was talking to the daughter and she said something about, you know, I'm glad you and I can talk instead of you and my brother because he just doesn't get it. He figures that you guys aren't doing a good job, and I know you are, but it hurt because you're in there and you just love them to pieces. You're working hard, you're keeping mom dry, you're keeping mom safe and clean and feeding her, and it's like, oh shit.
That does hurt when you know you're doing something.
Denial, the brother has denial.
He does, and he also...
And he pays the bills, so...
But it's also his perception. He may be so tight-fisted with the money that all he's focusing on is the money. And he's not, he wouldn't appreciate you if you were Saint Teresa. So, you know what I mean?
Yeah.
So, but then the other brother came along, and he's a little farther along, obviously, in life and his growing, and understands that you're working very hard, and you're... So again, it's not about you, it's about him. But it does hurt when we are working very hard and doing a really good job and really going the extra mile for someone and they don't appreciate it.
Took mom on trips to see animals.
That was very, very
Put the
nice of
kibosh
you.
on that. Don't want you taking mom out anymore. It's
Oh,
like,
that was nice of you to do that.
oh, love her to pieces, yeah.
Okay, so it's his problem, not yours, right? And you will have another opportunity maybe to do that for someone else. But just be the best you can when you're with her in the home, and don't worry about what he's thinking. But again, that has to do with perception of where he's at. Not in a good place, obviously, to not appreciate your hard work, you know? Yeah, so.
I want to correlate this discussion a little bit too to a concept that I'll express in this way. I spend half my life among my colleagues at work. I have 2 families.
You do.
I have my family of origin and I have my work family. And there are just as many dysfunctions in a work family as there are in a family of origin.
Absolutely.
And so I think we extend all of these ideas, we have to extend all of these ideas into every element of our life, not just think that only dysfunction only happens at home, because we know otherwise if we're open-minded.
Exactly.
And what I see around me by experience is organizations that are really successful are ones who assist their employees to cope with and better manage and become more aware of dysfunction in behavior and thinking, so that they can apply it not only in their personal life but in their work life.
Yes.
And you know, when you have that knowledge and those skills being practiced, the work production is better. The quality of the environment where workers are working is better. The attitude is better, and on and on and on. So I guess I just didn't want to leave the discussion without making an extension of these ideas to the other half of my life, which is my work. Because how I treat anyone sitting around this room with me is as important as how I treat my sisters or my mother,
Right.
or my sister, my father. I mean, really, it is. And I can't, if I separate it and say, well, I'm this person at work and I'm this person at home, which many people compartmentalize themselves that
They
way.
do.
And they act that way.
That's very
You know, it's easy to do. I know I can go home and be a completely different person to my wife than I am to everybody here all day long. I can do that.
Yeah.
And it isn't successful most of the time. and it doesn't lend to a positive relationship when I do that. So I'm bringing it up because I think other people do it as well.
I think people do compartmentalize.
Yeah.
And I think, but see, healthy families do that with one another. They're able to do exactly what you're saying we need to do in the workplace, but a lot of us didn't grow up in healthy families where we
True.
got that input and that
Right.
nurturing.
Right.
So we didn't then consequently know how to do it ourselves in our own families when we were parents and children. And all. So now we're all dealing with a lot of all of this stuff and trying to overcome it. But that's how it happens. It's generational,
Yes.
right?
Yes.
So if we had healthy families to begin with, and we weren't, you know, impacted by that initially, we wouldn't have all those hurdles to try out. But unfortunately, that's the world we live in today. And that is the society we're in. And we are a very dysfunctional society.
We are, that's very true.
But we are becoming aware. So I
Yeah.
don't think our parents and grandparents were as aware at all
They
as
weren't.
we are.
They weren't.
So we're ahead of the game a little bit, and hopefully our grandchildren, maybe not so much our children because they experienced a lot of our own dysfunction before we got it,
Yes.
but hopefully our grandchildren, you know what I mean?
Yeah.
So. you
And the
know,
good
it
news is there is a, we are able to make change in a positive way.
we are.
We don't have to stay stuck in those dysfunctional thoughts and dysfunctional behaviors at all.
Exactly.
And like you pointed out, and it's true for me too, I was older. I was in my 40s when I finally got it.
Yeah.
And figured it out and decided now's the time I gotta go in a different direction.
Right.
And I went. And fortunately for me, I stayed on that different direction pathway and fortunately became a better person for it.
I think that's the case with a lot of people today, so.
Yeah.
But this is why, you know, talking about it is a good thing and being able to be real and being able to share, I think it's so important.
Yeah.
I do come back and bounce things off Alan.
It's perfect, perfect.
It's wonderful.
Yeah, that is so perfect to be able to do that.
Yeah, I welcome it, because not only do you bounce things off from me, but it gives me an opportunity to get your input as well. And to offer, you offer me, you may not know it, but you offer me in return thoughts and ideas that mean something important to me as well. So it's a mutual kind of sharing experience, and that's where a functional relationship occurs when you're doing something that's
Right.
mutual and satisfactory to both people, rather than one person gaining everything and the other person losing everything.
And that's what healthy families should be.
Right.
But unfortunately, you don't see a lot of that. Healthy families do that. I think it's very important for all of us to have someone to be able to talk things through with.
Yeah.
How many of us could do that in our families? I don't know about you, but I couldn't go to my parents and talk things through, not really.
Yeah.
No.
Because there was a lot of guilt and a lot of judgment and a lot of,
Yeah.
you know, I did something wrong. So
Yeah.
it's okay, even if I did something wrong, I need to be accepted and loved, and I need you to help me through this.
Yes.
And that was never how I felt as a child. And I know that is part of the problem. But healthy families would say, you know, that wasn't good. You know, I wish that hadn't happened. Wish you had done it differently or whatever.
Yep.
But I love you. I will always love you, and not judge. You know, but we were judged, and so therefore we got to a place where we didn't talk about things. And that's how we get into denial, and then that's how we repeat the dysfunction. We do the same thing. So it's amazing to get to a place where you understand all that, and then let all that go, and then try to become the best that you can.
I don't think we should leave this discussion either without expressing, and I'll take the opportunity to express this. I believe it is right to choose to find a professional person to help when you are so dysfunctional in your thinking or your behaviors. Because while it's good if you have a close person that you can connect with and share these things with, the objectivity of a professional can be the starting place to push you in the right direction so your future relationships are healthier and result in better relationships with people, as opposed to, you know, what you would have without that professional start. And so I just want everybody listening to this tape to realize there is a solution here. This dysfunction can be solved. There can be, there is a way out, and it might sometimes require the help of a professional. Don't hesitate to go to a
I think it always requires the help
professional.
of a professional.
You think it always does?
Always.
Yeah.
And I think talk therapy, I think counseling and cognitive therapy is essential in recovery. Yeah, because you can't do it. So I guess when I approach what I'm talking about, that for me is a given.
Oh, okay.
As a former counselor, I understand this is so important. I think my going through what I went through, cognitive therapy, behavioral therapy, was imperative. It changed my life, being able to talk to a professional, because even if you were in a healthy, functional family, or you have a friend that you can talk to, there are some things you are not going to share.
Right, you're not going to reveal
No.
it. Yeah.
And I can also remember, even when I first started counseling, I wanted to impress the counselor with how well I was. So I wouldn't in the beginning always share everything. And it wasn't until I got to a place where I said, you know, I don't give a care. I don't care what he thinks. I am going to lay it all out on the table, because this is what's inside of me, and I don't want it to create sickness because I'm holding it in. So it wasn't until I started being real, like we were talking about before, and being very truthful and very honest with all of my everything. You know, good, bad, indifferent, and ugly.
Yeah.
And then, you know, I talked about everything. And that was so freeing for me. So I agree with you. I think it's essential. And I think it's very rare that people come through it on their own.
Yeah.
So I do think professionals are very important to talk things through with.
Yeah.
But I also think you have to sometimes shop around.
Yes.
Everybody
Yeah.
isn't a good
Yeah.
fit. And I think I probably saw 6 different people before I was very comfortable with someone and really started to make strides.
Yes. Yeah.
And I'm very grateful to this young man to this day. And he
You're
was
grateful
young.
to him, is that what you said?
Yes,
Yeah.
I'm very grateful. He was younger than I, and he was just a young kid right out of college. And I thought, oh boy, how's he going to help me? What does he know? But he was the best. He really was. And this was 35 years ago, but you know, like, I'm just saying, it was quite an experience for me, which is why eventually I went into the field after, you know, working things out in my own life and lots of history and different experiences and such. And I didn't do that until I was older, actually, when I went to school and went into the field, but loved it. But I think it's very important. So I agree with you, and I'm glad you brought it up, because I just assume that that is understood. When I speak, that people understand. I just assume people understand that counseling and therapy is very important.
And I want to add before we end also that coupling that professional support, which can be most of the time short term,
Yes.
with a longer term self-help type of support system.
Yes.
Be it Alcoholics Anonymous, Narcotics Anonymous, Al-Anon, you name it, you name the program, okay, they're all out there.
All of those.
Doesn't matter. But
Yeah.
any of those for long-term maintenance are essential too,
Yes.
at least in the early years of your change.
I agree.
Because without having other people looking at life the same way you're trying to look at it,
You feel
reminding you of what you want to ignore or what you
Yes.
want to avoid, you know, you're left to your own devices in your head, and that's not a good place to be. I was once told the worst place to be is alone in your own mind.
Yes. And they do become your family for a time.
Yes,
And
they
it doesn't always last like for years and years and years,
No.
but again, like you say, ultimately in the beginning, I think 12-step programs are very good as well, and I did too experience that.
Yep.
All of those things, any of the tools that we can use to gain an understanding about our history or who we are or our life, or to help us change our perception.
Mm-hmm.
It's in changing our thinking that healing comes. When we change our thinking about things, and we don't do that alone. We do that by reading, by talking, by counseling, by support groups. All of those tools are very important. Those are all of the things, and they're right there at our disposal. I mean, all of those things definitely make a big difference. I agree.
Yeah. Well, does anyone else have any ideas or questions that you would like to offer? No? Well, then, Sharon, thank you so much for joining us today and giving us your insights to this
Thank
topic. And those of you out in the audience who are listening and reviewing this tape, please understand that we are a company, TLC is a company that wants to support you. And should you have need to come in and have a conversation with a manager, don't hesitate to do that, or pick up the phone and call. And if we can help you to find whatever support you need in the way of changing dysfunction in your life or helping you to overcome a challenge, we would like to offer you the opportunity to get the right services, and we can at least point you in the right direction to find those. So I end this conversation with that encouragement. And again, thank you so much, Sharon, for being with us today.
Thank you so much.